Hello, everyone. My name is Khadijah Kane, and I will be speaking to you about primary care pediatric nurse practitioners. What is a primary care pediatric nurse practitioner? The Pediatric Nursing Certification Board states that the role of the primary care pediatric nurse practitioner is to provide care to children from birth through young adult with an in-depth knowledge and experience in pediatric primary health care, including well child care, prevention, management of common pediatric acute illnesses, and chronic conditions. This care is provided to support optimal health of children within the context of their family, community, and environmental setting. Primary care pediatric nurse practitioners work in different settings. These include private practices, ambulatory and school-based clinics, within their homes, in the hospital setting, and subspecialty clinics. These may include neuro clinics, cardiac clinics, HNT clinics, etc. So PNPs can work in different settings, but they also do different things on a daily basis. This includes assessing growth patterns, evaluating developmental milestones, and educating parents about normal growth and development, eliciting comprehensive health histories. They may order and interpret common labs and diagnostic tests. They also diagnose and treat common acute illnesses. They prescribe medications and they order immunizations. They also perform physical examinations, which include school physicals, pre-participation sports physicals, and general well child exams. They also provide anticipatory guidance. PNPs work with many healthcare professionals. These include a leading pediatrician, in which they work with most of the time, nurses on the unit. I remember when I worked at Children's Hospital, the nurse practitioners would ask me how the patient did the night before, what they complained of, in order to help with their future care. They also may communicate with medical assistants, administrative staff, mental health professionals, social workers, the dietitians and nutritionists, care coordinators, and most importantly, the patients and their families. Guidance and coaching are very important within the pediatric population. Pediatric nurses use critical thinking skills and form interdisciplinary partnerships in order to provide optimal care to their young patients. The role demonstrates the personal and collaborative approach that defines all NP practice, but nowhere does diagnostic skill and competence in clinician-patient interaction have more importance than in the pediatric environment. Pediatric care importance spans a wide spectrum, covering newborns, infants, children, adolescents, and young adults. These patients are often unable to fully articulate their concerns, pain, or disability, and so they rely on prospective and highly skilled practitioners to assess their needs and ease their fears. It's very scary for pediatric patients to be in a state where they're not comfortable in. And usually that's in the hospital setting or when they're at the clinic. Most of the time, these children are scared. So it's very important as practitioners to make them comfortable so that they understand that we're here to help them get their health better. The overall goal for guiding and coaching patients within the pediatric population is to educate them and to help them understand that um, they're here to get better. And ways that we used to do that when I worked at Children's Hospital is first asking them how they learn best. If they learn best visually, we had a screen in front of them, a TV screen in front of them, in which we provided visual videos explaining their conditions and what interventions could be taken in order to help them. And most of these videos were based on their age and their comprehensive level, so that we knew they understood the information that we were giving them. If they were tactile learners, we would provide them with hands-on material. Some of the social workers would come in and have them color things. We would also have little models of what was going on, for example, with their kidneys and why they were reacting the way they were. We also had videos for those who are auditory learners. So we made it fun so that they knew, they understood what we were talking to them about, but they also weren't scared to acknowledge what was going on or ask questions when needed. I read an article by many authors, and it mostly talked about team-based care in pediatrics. The overall goal of team-based care is to enhance communication and cooperation among the varied medical, social, and educational partners in a child's life to better meet the global needs of children and their families, helping them to achieve their best potential. In support of the team-based approach, the AAP urges stockholders to invest in infrastructure, education, and privacy-secure technology to meet the needs of the children. So, with the team-based care, it involves all of the collaborative teams and including the patients and their family in order to understand what the situation is and what the best approach is in order to get them to where they need to be. This in turn helps the patient and their family feel more involved in their care, which is very important, and it also creates a rapport between the clinicians and the patient and their family. So some leadership opportunities for this role as a pediatric nurse practitioner in the primary care setting include administrative leadership, operational leadership, and care delivery focused leadership. So the nurse practitioner is usually very qualified on the basis of training and expertise to oversee the team. They provide administrative oversight and serve as a resource to promote optimal functioning while meeting the needs of the patient and family given available resources. From an operational perspective, other members with child and or adolescent expertise may be the most appropriate team leaders to oversee and provide details of care delivery. This includes those subspecialty nurse practitioners that I was talking about earlier, for example, cardiac or renal or GI. Those are the ones who specifically can lead the healthcare of the patient and guide the other team members towards giving the patient the best amount of care. New team members may require additional levels of support and training as they learn how the team works, and interprofessional education allows all team members to gain in knowledge and expertise over time. So it is up to the leading nurse practitioner to involve any new members and explain everything that is going on in their healthcare and provide the best amount of care for the patient. Last but not least, this is my reference page. I hope that you guys enjoyed this presentation, and if you have any questions, please comment below.